Hello everyone. In this video lecture, I will be discussing the safety in the laboratory. So this will be our last topic for the prelims. I will be discussing the parts 1 and 2 of the safety in the laboratory. So the following are the objectives in this discussion. First, we will be defining infection control, what is the importance of infection control, as well as the chain of infection, what are the different steps in proper hand washing, and the list of the PPEs needed in the following: standard precaution, airborne, droplet, and contact precaution. So some of these topics were already discussed in your laboratory, but we will have a more detailed discussion about the following. Okay, so what is infection control? Basically, this means from the name itself, we are controlling the infection. We are controlling the spread of the disease in order for us to minimize the number of healthcare associated infections. So this is focus class on the on the infection that you might get in your hospital stay or in your workplace. So it concerns with the prevention of nosocomial or healthcare associated infection. So in the hospitals class, we have this infection control team. It is composed of different um, staff, different professionals, na ay medtech, na ay nurses, na ay doctors. So their task is to identify if ever there's an outbreak or increase of infection that happened inside the hospital. So they will be conducting investigation on how the infection started in order for them to contain the infection and will stop the further spread of the infection. So here we have these factors that under infection control. The first one is prevention. Example of this is hand washing, disinfection, vaccination. That is a form of prevention. And when we are going to sterilize our utensils before we eat, so that is a form of prevention. The next one, if the infection is not prevented. So the next step is monitoring and investigation. So during monitoring class, we are going to identify what is the source of infection, and for example, the COVID-19, we can contact tracing for us to inform those individuals now with contact with the patient to isolate themselves as well. So that is monitoring. And the last one is if ever it was not properly monitored, wala gihapon na contain ang infection, so that's the time where there is already surveillance, investigation, and management. This will happen plus pag naanay outbreak or katong COVID-19, it is already termed as pandemic. Okay, so in this factor, we will be focusing on treatment of the patient. We'll be focusing on improving our facilities in order for us to cater those patients with the said infection. So that is management. So among these three factors, the very important to be strengthened is the prevention. Kay if na-strengthen si prevention class, no need to monitor, no need to conduct surveillance, no need to conduct contact tracing. It's because at the very beginning, the infection is already controlled. Okay, so let us define these two terms or these two types of infection. So I know that this was already described no, in your laboratory. So just a sort of review. Nosocomial infection, also known as hospital-acquired or healthcare-associated infection. So from the name itself, we contracted this one inside the hospital setting, or for example, you are admitted to have dengue, but after a few days, you are diagnosed to have pneumonia. So, you have this another diagnosis which most probably nakuha nimo sa hospital setting. Because this nosocomial infection can not only be acquired from patient to patient, but also class if ever ang surroundings sa hospital is not clean. Mga beddings, mga linens, it's not na-change siya on a daily basis. So, it might be a reason why an infection can be contracted by the patient. The next one is community acquired. So, community acquired infection class, these are communicable na mga diseases. So, when you say communicable diseases, it can be spread from person to person. Example of this is kanang pneumonia, COVID-19. Um, for you to clearly understand more, I will give examples of non-communicable disease. So, non-communicable disease class, example of this is kanang diabetes. Dili ka matakdan og diabetes na from other people. Hypertension, those are non-communicable. When we say communicable is natakdan ka from your silingan, from your playmate, so that is communicable diseases. So these are infection that clinically apparent within 24 hours or 48 hours from the hospital admission. So the disease is contracted by the patient before getting admitted to the hospital. So for both our nosocomial and community-acquired infection class, there are two types of infection. It can be local or systemic. When we say local class, only specific part of the body is affected. Example of this, very simple, the pimple. So, only that specific area ang na-infection. Another one, for the systemic, the second type of infection. Example of this is the chickenpox. Your entire body naa siya presence of blisters. So, systemic, tibuok ni mga lawas is affected. Okay, the next one class is we have here the chain of infection. So as you can see in the illustration class, it is continuous. Okay, in the illustration, it is, as you can see, it is continuous. Padayon siya naga-tuyok-tuyok ang arrow. So, let us identify or familiarize each of the following factors that is present on the chain of infection. So the first one, class, is we have our agent, or layman's term no is germs, but since na naman kita sa medical field, so we term this one as pathogens. So it can be bacteria, it can be a virus, or it can be a parasite. So depending on the type of the virus that harbors the condition, so it has the capacity or potentially you will acquire a certain condition. Okay. So the next one, plus, is asa man nato ni makit-an kining ang ato ang mga pathogens. So we term that one as reservoir. Diri nato makit-an kining mga pathogens. Number one is people. Of course, we are a good reservoir of these pathogens. Even in our even in our hands, class, daghan kayo pathogens present. That is why the very basic thing to break the chain of infection is through hand washing. It's because at this level pa lang, you already destroyed the reservoir of this pathogen, so you cannot further spread the infection. It's because you perform proper hand washing. So that is number one. Number two, animals or pets. So I know some of you here are animal lovers, pet lovers, na may mga dogs, na may mga cats in your houses. So, just be cautious in holding your cats or your dogs or your other pets, because they can be an ideal reservoir, or very good reservoir of these pathogens. So, wild animals, the food. Yes, the food can be a source as well if the food is not properly prepared or if the food is already soiled. So it's time to discard it, or the pathogen can stay in that specific food. And then the soil and the water. If the water is contaminated with the pathogen, it's a good reservoir as well of pathogens. So after that, is we already identified the reservoir. Okay, so let's say from the people. So, paano man ni siya mo gawas sa lawas? No, paano mo gawas ang infection sa lawas? So that is we term it as portal of exit. Okay. So if you have ubo, okay, so the portal of exit of the pathogen that you have inside your body is through the mouth. Okay, so during your ubo or during your chika-chika with your sipmate, or when you vomit, so that is the portal of exit. Another one, if you have cuts in your skin, so the blood will come out. That is a ideal portal of exit. And kana ng toileting. So if the walay maayo na septic tank, so that is one of the problem, no, especially sa ato ang mga water source. Ana. So because that can be the means where these pathogens can exit from the reservoir. So after that class is nag-exit na siya. So, we are already on the mode of transmission. Paano ang iyahang mode of transmission? So, we have different modes of transmission. Later on the next slide, I will be discussing the different types of mode of transmission. So, paano man matransmit since naka-exit naman si pathogen on the reservoir? Paano siya makatransmit on the next host? Okay, so we have examples here. It can be through contact or it can be through droplets. So later on, I'll be discussing this one in detail. So you already identified the mode of transmission. Now, is paano man siya musulod sa next na host? So we have here examples. So we term this one first as portal of entry. Asa man siya musulod to the new host. Number one, of course, is through the mouth as well. So, always nagkakatawa si seatmate, tapos timing nga na nag-ubo ka, so imuhang laway na transfer kay seatmate. So, that is an example. Cuts in the skin and the eyes. For example, class, since baha season naman gid karon, no, so the most common na sakit na ato ang makuha during kanang baha is leptospirosis. Okay, so even though maglangoy-langoy ka dira sa baha, even though nainom nimo ang tubig sa baha, dili ka magka-leptospirosis unless naa kay samad. Okay? Because the portal of entry of this leptospira is through an open wound. Okay, that is the only portal of entry. No other portal of entry for our leptospirosis na sakit. So that is cuts in the skin and the eyes as well. It can be a portal of entry for some of the pathogens. Okay, the next one, we already identified the portal of entry. Now let's proceed with the susceptible host. So for our susceptible host class, they are termed as susceptible hosts because these are people who are very vulnerable with weak immune system or immunocompromised na mga individuals. So let's name these examples that we have here. Babies and children, they are susceptible hosts. It's because their immune system is not yet fully developed. And we have here elderly, kaya ang ilang immune system is already nag-decline, weak na ang ilang immune system. So people with a weakened immune system, those who are already with underlying condition, kanang naay TB, naay hepatitis, naay HIV, so they can be a susceptible host. And unimmunized people, of course, that is why very important gyud, no, one of the requirement of the school na dapat nakapavaccine na gyud mo because that is another way to protect the students, no, in harboring a condition. Kaya if ever wala naka-vaccine, of course maka-absent gyud sa klase. So very very important. And anyone, of course, sa panahon ngayon, any one of us can harbor different sickness. That's why it's very, very important to be safe. And the cycle goes on and on and on. Okay, so continuous gid siya ang cycle. So once you already have this, um, you already harbored a certain pathogen in your body, of course, makapasa na pod ka sa new na pod na susceptible host. So, as what I have mentioned earlier, at the very beginning pa lang, as pag naanatay mga pathogens on our hands, always make sure you to perform proper hand washing for you to break the chain of infection as early as possible. Okay, so the following are the modes of transmission. Number one is through contact. So among the different modes of transmission, this is the most frequent source of healthcare associated infection. And it can occur by either direct or indirect contact. Okay, so direct contact, that is through skin to skin, person to person na transmission. While the indirect, that is because of a fomite. When we say fomite class, that is a non-living item in which it harbors pathogen. So, this is the most common na type of transmission that occurs within the healthcare employees, ang indirect. If ever, si medtech nakalimot wash sa ilang hands, nakalimot mag-change sa ilahang gloves from one patient to another. So, that is indirect. The next one naman is droplet. So, droplet from an infected person are propelled short distances. So, imagine, in one ubo lang class, one sneeze, your laway can reach up to 3 feet. So imagine usa na kalayo, unsa kadaghan imuhang people na na-shower ang imuhang pathogen. So always remember, when you sneeze, when you cough, always cover your mouth. Okay? Airborne. So airborne, so example of this is tuberculosis. So patients with tuberculosis class, different na ang ilahang room. So, we term that one as isolation room. You cannot mix a patient with tuberculosis with other patients na ay dengue, na nagpa-appendectomy, nagpa-opera. We cannot do that. It's because, remember, tuberculosis is airborne. So, pag nag-ubo si pasyente na ay tuberculosis, naglutaw-lutaw sa hangin ang pathogen. So, most probably, ang iyahang mga kauban sa room, naka-ward si pasyente, pwede po na ma-inhale niya ang tuberculosis. So, that is airborne. Later on, I have a more detailed discussion about isolation. Okay, the next one is through vehicle-borne. So, when we say vehicle-borne class, so this one, fomites come in contact with contaminated items such as the food, linen, and equipment. That is why very important good na i-change ang beddings no sa mga hospitals every day. So i-change yun na siya every day. And vector-borne. So vector-borne, living host comes in contact with a contaminated item. So example ani, the mosquitoes, the ipis, the rats, the flies. So they can bring or they can transmit the condition as well. Okay, so how to break the chain of infection? Very, very simple. The proper hand washing, proper hand hygiene. So this is the most critical step that we can perform in preventing the spread of infection. Okay, the next one is we have here the list of the basic personal protective equipment. So these are the equipment that we wear inside the laboratory and in the hospital premises in order for us to minimize exposure to different hazards that is present in our workplace, no? So in case of injuries or kanang na ay mga illnesses si pasyente, so we will be able to protect ourselves. So the use of this PPEs class, it is mandated by the OSHA, or the Occupational Safety and Health Administration. So in order for us not to minimize our exposure to bloodborne pathogens. It's because we are processing daghan kaayo ng mga blood samples no during our shifts. So we just have to follow this mandate from the OSHA. Now, this is only for our own protection, ma'am po. So, we have here the lab gown. So, it adds on additional layer of protection for the skin. So, why is the lab gown color white? So it's because for us to see immediately if naabay na spill na blood sample, naabay na spill na body fluid on our lab gown. So we can wash it immediately. Another one, our lab gowns class, it must reach the wrist of our hand. As much as possible, wala gyud siya yung mga skin na ma-expose when we are in the laboratory. Kaya in case of mga chemical spillage or sample spillage, so it will not be directly in contact with our skin. The next one is we have the gloves. So of course, we need to wear it every time we perform blood extraction. We need to wear it every time we process different blood samples or body fluid in the laboratory. And of course, do not forget to change your gloves or in between patients. Okay, basig ikaw pahinon ang source sa infection. And mask. Of course, not only for patients with transmissible diseases, but to all patients nga imong nag-encounter sa um, hospital. And then we have goggles. So this is usually worn class sa histopathology section in the laboratory. It's because in that section, daghan tag mga chemical preparation, just like dilutions ato ang formalin, preparations of our alcohol. So these are highly irritant na if mag-splash ato ang eyes, it can lead to blindness. So we must wear goggles when we prepare the chemicals. Okay, other than the PPEs mentioned, these are the things that we must remember, no? So, long hair must be tied back. Another one, long pants that cover to the ankle. So, as what I have mentioned, dapat wala yung mga skin na ma-expose when we are in the laboratory. So, shirts that cover the torso. So, lain po no if crop top ang mga uniform sa laboratory. So, wala tayong ana. And we have this recommended fiber for the lab gowns and shoes completely enclose the foot. It should be nang naka-close gyud ang foot. Actually, ang mga Crocs class that is not ideal is because na siya yung mga holes. So if ever na ay mayabo sa imuhang tiil, nagihapoy direct na skin to skin contact. So that is why it should be kanang fully closed ang footwear. Okay, so hand hygiene during patient interaction. So, number one, before touching a patient. So, why is it important to perform proper hand washing before touching a patient? So, it's because for you to prevent the spread of infection. Dili lang ba si pasyente ang imong gigunitan for your entire shift na kay different patients nga na-encounter. So, para dili ka makadala og sakit kay pasyente, remember to wash your hand before touching the patient. Number two, before clean or aseptic procedure. So, just like blood extraction. So, ideally, class, before ka magsuot og gloves, you need to perform proper hand washing. So, um, you must wash your hands. After that, wear your gloves, then proceed with the blood extraction. Number three is after body fluid exposure. So, this is for our nurses, no? Ng example, mag-collect sila og catheter bag. So, of course, they need to wash their hands after. And then, after touching a patient, number four, that's very important as well, kay this is to protect ourselves. Na if ever na atay nakuha na infection kay pasyente, so just by simple hand washing, dili na to kuha ang sakit or dili na to madala ang sakit sa laboratory. And then, number five, after touching patient surroundings. So, that's very important to wash our hands. Kay remember katong droplet, it can reach up to 3 feet. So, if si pasyente nagaubo, most probably, ang mga gamit sulod pud sa iyahang room is contaminated with a pathogen. So, always good, wash your hands after touching the patient's surroundings. Okay, so if hand washing with soap and water is not available, the ideal alternative is to disinfect your hand using a hand sanitizer. So, acceptable po ni siya class if your hands are not visibly soiled. Okay, nang dili kaayo, walay blood stain. You just want to disinfect your hands. So, this is an ideal alternative. So, actually, the same lang yun siya og steps. Ang difference lang yun nila is after the kining number 7 na steps, we will let our hands to air dry. Dili ta magamit og alcohol to dili ta mo gamit og unsa ni og tissue or hand dryer to um dry our hands. So the same lang gihapon siyang i-follow na steps actually. So, kini siya, I'll just leave this one to your laboratory. I know this was discussed properly in your laboratory. So, just remember the following steps in hand washing. Okay, so now let's proceed with the second part, which is the different precautionary measures that we must remember in the hospital. Okay, number one is universal precaution. This one helps protect health workers from exposure to blood-borne pathogen. So, universal precaution class only specific to um, the following specimen, only to blood, semen, and vaginal secretions, and most body fluids. But this type of precaution class did not apply to fecal sample, to nasal secretions, to sputum, sweat, tears, urine, so, or vomitus unless they are contaminated with visible blood. So, it is only specific to the following samples that have ng connection with contracting HIV or AIDS. It's because class during the by the time that they created universal precaution, maupod ni siya ang time na increase ang cases sa HIV. So, it is focused on blood samples na ideally makakarry og or carries the virus. So, even though it is named universal, no, but it's not to most of the samples that we are processing in the laboratory. That is why in 1996, the Centers for Disease Control and Prevention, they expanded the recommendation um, in order for them to include those katong mga fecal sample, the urine, to protect the healthcare workers. So they created this standard precaution and isolation precaution. Okay, so first is the standard precaution. So this one includes or it applies to all body fluids, all the secretions of our body, all the excretion. But we still have one exemption class. It's the sweat. That is one exemption. So, it combines hand hygiene and PPE use when working with blood, body fluid, non-intact skin or mucous membrane. So, in order for us to reduce the risk of microorganism transmission. Okay, so that is standard precaution. The next one, class, is we have this isolation precaution. Okay, so this is the room setup, no, of patient with or needs to be isolated. Okay, I'll give you an overview no on unsa dapat ang himuon pag mukuha mo og dugo sa patient inside the isolation room. Dili man gyud na siya like the usual layout lang ang room sa patients. So, this is the main door. So this is where we enter, no? And then dili pa nato makita si patient immediately. So na siya area here where we can put our things. So since magkuha man ta og dugo, we will bring our phlebotomy kit. But we cannot bring the entire phlebotomy kit on the presence of uh, ni patient. So we just have to bring unsa ato ang kailangan. So just bring our syringe, tourniquet, the cotton, unsa pa ba? The wet and dry cotton, the plaster, so just the things that we need during the extraction. After that, after securing it, so we can go inside this door where naa si patient. And we must perform blood extraction as fast as you can. Less than 1 minute dapat naka-perform na ka og blood extraction. So in order for you to minimize your exposure sa patient or inside the room, remember, kanang patient for isolation, naana sila yung mga airborne. Airborne ang mode of transmission sa ilang condition. So that is why nagalutaw-lutaw lang yun na siya sa hangin ang pathogen. So, ako ang practice before class, after blood extraction, balik ko diri sa kini na area. Then, diri ko na area mag-label. Diri ko na area mag-transfer og dugo from the syringe to the evacuated tube. Okay? So, ma'am, I thought bedside manner. I thought sa tapad gid ni pasyente mag-perform og or mag-label og sample. But in this case, class, natay exemptions, no? So, we are sure man na ang tag-iya sa dugo is the patient. It's because siya naman ang isa sa sulod sa isolation room. So, we can do the transferring of blood here and the labeling just to minimize the infection. And different ang ventilation class inside the isolation room. So, dili siya ng aircon, dili po siya naka-electric fan. Kay if aircon, of course, maglibot-libot lang yun ang hangin, no? Sulod sa room. So, it needs to have this, naa siya yung negative pressure inside, and then, this, mura siya og kanang exhaust. This exhaust class is naa siya naka-filter. Okay, para of course, ang mga aerosols that is present inside the room must be filtered first before ma-exit siya on the outside. Okay. So, we have these two forms of isolation class, the source and the protective. So, for source isolation class, this is for the patients, or we are isolating the patient for us to protect other people from becoming infected. So, dili na to ni sila pwede isagol sa mga patient na naaylaing sakit. It's because if isagol na to sila, mas madungagan ang sakit sa ubang pasyente. So we need to isolate them for them to not infect other people pa further. While protective isolation, what is the meaning of this, ma'am? So this is for our immunocompromised patients, such as the HIV. Kaya kanang patient nga na ay HIV, simple na ubo, simple na sipon, it can lead to their death. Dili nila makaya, dili makaya sa ilang immune system to fight that very, very simple na infection. That is why we need to protect the patient. We will isolate the patient para dili sila matakdan sa sakit sa outside. Okay? So, ma'am, what if ako ang phlebotomist of the day, ma'am, and then amang ko'y ubo or sip-on? Am I allowed to extract blood to patient under protective isolation? No, you are not allowed. So, from the name itself, protective isolation, we are protecting the patient from any infection outside. Okay? Para dili siya matakdan kung unsa man ang sakit on the outside. Okay? So that is isolation precautions. Okay. The next one is medical biohazards. So we already know this one. Most of our waste na mga materials in the laboratory, it is completely infectious. So this sign is very important para mahibal-an sa naga-dispose or kanang mga trucks, no, who are collecting ng mga garbages, na these waste are highly infectious, so they must separate it from the regular household waste. So, it should be placed in a red container. So, if red container is not available, sorry, as long as this biohazard symbol is present or nakadikit, so that is still acceptable. So this one is regulated by the OSHA and the CDC. Okay, next is electrical hazard. Ma'am, why is it important to include electrical hazard? It's because class, pag nakasulod na mo sa laboratory, most of the things na inyong makitaan inside the laboratory is machines. Of course, these machines will not work if walay source of electricity. Okay, so we need to remember the following precautionary measures in case of emergency, kabaluta on how to minimize electrical hazards. Okay, number one, use three-pronged or grounded plugs to avoid short circuit. So, I think you already seen this one, kanang naagoy tulo ka ng saksakanan ang inyong mga gadgets, ang inyong mga laptops. Okay, so actually even sa inyong mga not furnitures, appliances at home, that is the most ideal one to have this three-pronged na plugs. Okay, if your hands are wet, of course, do not touch the machine. And if naa kay madungog na unusual sound, ang machine, unusual smell, so turn it off or unplug the machine. Okay, dili magpanic, especially if the machine is naa sa imuhang section assigned. So turn it off immediately. Okay, basig mag-explode doon sa banana ay it can be a cause of fire. And then do not use extension cords. Our machines is very big. It's much bigger than your refrigerators at home. So extension wires are not ideal. Okay? Dili ideal sa extension wire, it's because it requires higher voltage. So, it should be kanang nakaano gyud siya nang naa sa wall mounted. And kana turn off electrical equipment if na ay mga power failure, na ay mga brownouts. So, to avoid surge when power is restored. So, that is why ang mga machines class na siya yung naka-built-in na UPS or the uninterrupted power supply. Okay, in case of kining na ay power interruptions, so dili siya automatically ma-turn off ang machine. Kay it can, ano man good, it can, pwede siya maging reason why maguba ang machine if always lang siya naga-on off, on off. Okay, the next one is we have here the fire and explosive hazard. So we need to remember this one as well. Plus, it's because we have so many chemicals in the laboratory that can be that are combustible. Okay, so we have here the race. Race. These are the 4 basic steps in fire emergency response. So R is to rescue. Now, if ever you are able to rescue others, that is the first thing that you must do. Then A is to activate the fire alarm or phone in the alarm. And then letter C, contain the fire as much as possible. And letter E, extinguish the fire if possible. Now, in the hospitals class, always yun na siya na fire drill. Kay para ma-remind all the time ang mga hospitals on what to do in cases of fire. So we have here the pass. So these are the steps to remember in using fire extinguisher. So P is to pull the pin and the handle. And then A is to aim the nozzle to the base of the fire. And then S is to squeeze the lever slowly. And S is to sweep from side to side. So we must remember this one na dapat presence of mind yun in case of emergencies. No, even though memorize yun nato ning race, memorize nato ning pass, pero pag abot sa sa emergency, dili gyud maiwasan no na magpanic. So, makalimtan na gyud ang tanan. So, just have that's an opportunity to help man. Okay, since you are knowledgeable na on what to do, so in case of emergency, naamay mo contribute that will help the community. And then we have here the classes of fires and extinguishers to use. So I will not be discussing this one in detail na. I just want you to read this one. Nani siya sa inyong book. What are the types of extinguishers that we will use for the different types of fire. Okay. Okay, so chemical hazard. Chemical hazards, this one includes potentially harmful chemicals, no, that we are using in the laboratory. So that is why important gihapon to be reminded of the following guidelines. Okay, so we need to use glasswares appropriate for the task. So avoid good using plastics during reagent preparation. And then, okay, when diluting an acid, add the acid to water. So una gyud si acid, then i-add siya sa water. Okay, so just remember acid, letter A. So siya imuhang ibutang si acid. So never add acid to water. Nga naman ma'am, because it can generate a great amount of heat and may cause a burn. Okay, so that is the reason why dili gyud pwede ang the other way around. And proper disposal, proper storage of chemicals must be observed and kana mga flame-proof metal cabinet. So dapat na yun na siya ideal na kinsa lang dapat ang tapad ani na chemical. Kinaay mga chemicals class even though they are placed in the containers, pag itapad nimo siya to those chemicals na dili dapat, it can result to explosion. Okay? So kindly check as well in your book the hazards in connection with this one sa page 35, chapter 2 in your book. And we have here class the NFPA diamond hazard symbol. This NFPA stands for National Fire Protection Agency. So this symbol class, it is designed to be used in emergency situation wherein we have this quick access to the information about the chemical. Unsa ba ang iyahang characteristics for it to be create that flame? Unsa ba ang iyang health hazard? What is the reactivity of this type of chemical? Okay, so let us discuss the different elements present on the hazard symbol. Okay, so number 3, the blue diamond. This one class indicates the level of hazard the chemical possesses to the health. So we have this Rorschach scoring system no 0 to 4. 4 is deadly. So we can assign numbers based on the unsa iyahang health hazard. The number 2, red hazard. So, red indicates a chemical's degree of flammability. Unsa ba na temperature? Pila ba ang degree Fahrenheit for it to create a fire? So, nana po na siya 0 to 4. And then we have the yellow. So, that one indicates the reactivity or stability of the chemical to certain temperatures. So, from stable to may detonate. So that is reactivity. And the white one class, so specific hazard, that is for a specific type of hazard. Is it alkaline? Is it acidic? Is it carcinogenic? Is it corrosive? Is it irritant? So very different types of hazards. So those are the different precautionary measures that we must remember inside the laboratory. So, thank you. And I hope that every one of you is safe today. And um, kindly, I want you to read further in the chapter 2 of your book. Okay, there are still some topics there that I have not included in my discussion because I want you to do extra reading about this topic. So, for our next meeting, since na-cancel man ato ang class today, so the coverage of the quiz next meeting would be topics 2 and 3. So, that's it. And thank you for reaching up to this point of the video lecture. So that's it. And keep safe, everyone. Goodbye.